Welcome to the deep dive. Today, we're plunging into a really perplexing and often quite debilitating condition that affects horses, photic headshaking. Now, just imagine for a second if bright sunlight, just normal daylight, made your face intensely uncomfortable, maybe even painful, leading to these involuntary head movements. That's basically what some horses go through. It can be a really striking and upsetting thing to witness.
It truly is. And our mission for this deep dive really is to unpack what exactly Photic head shaking is. We want to delve into its somewhat mysterious causes, understand how it actually shows up in affected horses, navigate the pretty intricate process of diagnosing it, and explore the range of management and treatment options out there. We're aiming to turn this, quite complex equine neurological condition into something understandable and maybe even fascinating for you.
Fascinating. Yeah, I think so. Because this isn't just some quirky behavior or like a bad habit the horses pick up. This is a specific type of trigeminal mediated head shaking syndrome, TMHS for short. We're actually talking about neuropathic pain here, pain originating from nerve issues. It's often compared to trigeminal neuralgia in humans. And the defining thing, bright light. Especially sunlight, that's what triggers or makes these really intense symptoms much, much worse. So let's really unpack this. Let's try and peer behind the curtain, see what's happening physiologically.
Yeah, you've hit on the core issue there. When we talk about what's happening, under the surface, we're talking about a neurological root cause. The main nerve involved is the trigeminal nerve. That's cranial nerve V. This nerve is responsible for sensation in the face in horses just like it is in us.
Right, the trigeminal nerve. So it's kind of ironic that the nerve meant for feeling things is actually causing this intense pain. How does that happen? How does that sensory input get so warped?
That's the key question. The core problem seems to be something called trigeminal nerve hyperexcitability. So in these affected horses, the nerve, especially the bit called the infraorbital branch, which gives feeling to the muzzle area, it is an abnormally low threshold for firing, for activating. What that means, basically, is that normally harmless things, stimuli like, say, a gentle breeze or even just light hitting the face, can register as pain, intense pain.
Wow. Okay, so this link between a nerve misfiring and light sensitivity, that brings up a really interesting hypothesis, doesn't it? Something that sounds a bit like a human reflex. The photic sneeze.
Ah, yes, the photic sneeze analogy. It's a great way to think about it. This leads us to the hypothesis of optic trigeminal summation. The idea is that there's some kind of abnormal interaction or maybe a convergence between the optic nerve pathways for vision and the trigeminal nerve pathways for sensation. And this crossover seems to happen right there in the brainstem. So light entering the eye doesn't just trigger vision, it somehow inappropriately triggers the trigeminal nerve too, causing that facial pain. The mechanism is thought to be quite similar to that human photic sneeze reflex, where sudden bright light makes some people sneeze.
So it's like crossed wires in the brain, basically, set off by light. It's pretty amazing that such severe pain can happen without any obvious structural damage to the nerve itself. Does that make diagnosing it even harder? Knowing you're looking for a functional glitch, not like a clear injury you can see.
It absolutely does. That's a huge part of the challenge. For most cases, the condition is considered idiopathic, which just means we can't pinpoint a specific identifiable structural cause. There's no obvious lesion or damage to the nerve. The problem seems to be functional how the nerve works, not how it looks. And this idiopathic nature is exactly why diagnosis is so tricky. You're not searching for a broken part, but an invisible glitch in the system software, so to speak. It really forces vets to be medical detectives. They have to rely heavily on observing patterns and ruling other things out.
Right, the process of exclusion. So if it's this functional glitch, then the next big question is when and why does it happen? What are the specific triggers for this pain?
Well, as the name photic suggests, bright sunlight is the big one. It's definitely the most common and defining trigger. Symptoms are almost always significantly worse when the horse is outdoors in bright sun. It often makes them actively seek out shade. You might see them trying to hide their heads in dark corners, under trees, even behind other horses.
That image, hiding their head, really drives home how bad it must feel. And you mentioned seasons. There's a strong seasonal link too, right?
There is, yes. A really high percentage of these horses show seasonal symptoms. Typically, things get much worse in the spring and summer, and then they might ease off or even disappear completely in the winter. And that pattern lines up perfectly with, the increased daylight hours and the intensity of the sunlight.
Makes sense. So sunlight is primary. But are there other things in the environment, other triggers that can make it worse?
Definitely. While light is number one, Other stimuli can certainly push a sensitive horse over the edge. We're talking about things like wind blowing on the face, sometimes rain, even dust or high pollen counts. Exercise itself can sometimes trigger it too. Often it seems to be a combination of these factors that really makes the symptoms flare up.
Okay. And I know people sometimes wonder about other factors, like infections or diet. Is there solid evidence for those?
That's where things get a bit less clear. There are theories out there, yes. Some have hypothesized viral infections, maybe something like the shingles virus in humans, could play a role, or dietary factors, maybe a magnesium deficiency, or reactions to certain feeds. Even rare conformational issues have been considered. But honestly, the research hasn't consistently backed these up as primary causes for most horses. They might be contributing factors in some individuals, perhaps, but sunlight remains the key.
Got it. So sunlight is the main culprit. Now, who gets this? Does it affect certain horses more than others? Age? Breed?
It primarily affects adult horses. The average age of onset is somewhere around 9 years old, and interestingly, studies consistently show that geldings seem to be affected more often than mares.
Huh. Geldings more than mares. Any idea why?
Not definitively, no. It's an observation from the data, but the underlying reason isn't clear yet. As for breeds, different studies have pointed to different breeds being overrepresented. One major study highlighted quarter horses, while another found more thoroughbreds. So it's not strictly limited to one breed type.
Okay, so now that we have a handle on the mechanics behind it, let's shift to what you'd actually see. For someone watching a horse, what are those telltale signs, the real hallmark movements that might make you think, maybe this is photic head shaking?
The hallmark movements are usually pretty distinctive, yeah. The classic symptom is that sudden, involuntary vertical head flicking or jerking. The horse will just abruptly, sharply throw its head up and down over and over. It looks almost like they've been stung on the nose by a bee. That's why it's often called the bee sting flick. And these movements can be really quite violent and obviously very distressing for the horse.
So it's not just a casual head toss like they're annoyed by a fly. It's much more forceful and repetitive.
Exactly. That's a really key difference. And while it's mostly that up and down vertical movement, less commonly you might see some horizontal shaking side to side or even a rotary motion. But the crucial thing to remember is the involuntary nature of it. The horse isn't choosing to do this. It distinguishes it from, say, learned behaviors or simple head tossing out of frustration.
Okay, that involuntary sharp flick is key. What about other signs? Things that show facial discomfort or irritation. What else might they do to try and cope?
Right. Besides the shaking itself, you'll often see other signs pointing to that nerve irritation. Things like frequent, sudden, almost explosive snorting or sneezing. You might see the horse violently rubbing its muzzle or the whole side of its face on its own forelegs, on the ground, against fences, stall walls, even using another horse's tail.
Wow, really trying to scratch an itch they can't reach.
Exactly. Or they might even strike out at their own muzzle with a foreleg. Sometimes you'll see their lips or muzzle twitching uncontrollably. These are all really just desperate attempts to relieve that horrible neuropathic pain or tingling sensation they're feeling.
Gosh, it really paints a picture of just constant nagging torment, doesn't it? And does this affect things beyond just their head and face, like their general behavior or ability to be ridden?
Oh, absolutely. It impacts their whole life. As we've said, the symptoms are almost always worse in bright sun, better indoors or at night. So that light sensitivity forces them to seek shade constantly. Behaviorally, because they're dealing with this chronic pain, they often seem anxious, agitated, maybe even generally distressed, and this can severely impair their performance. A horse that's constantly flicking its head can become dangerous to ride or even just handle on the ground. It can interfere with eating, too.
I can imagine. Hard to focus on anything else.
Precisely. And you might even see physical signs resulting from the behavior, like abrasions or sores on the muzzle from all that frantic rubbing. One really crucial point for diagnosis, though, is that when a vet does a thorough physical exam, they typically find no other obvious reason for the head shaking. No dental problems, no ear infections, nothing else explains it. So a big part of diagnosis is actually the absence of other findings.
Right, ruling everything else out. Which sounds like a massive undertaking for a vet, especially if there are no obvious physical signs. How do they even start to diagnose this? It must feel like looking for a needle in a haystack.
It can feel that way, yeah.
Yeah.
It's definitely a complex diagnostic journey. And you're right, there's no single definitive blood test or scan that just says, yes, it's photic head shaking. Diagnosis relies heavily on that rigorous process of exclusion. That's the most critical first step, ruling out a whole host of other conditions that could cause similar signs.
Okay, so what kind of things are on that exclusion list? What are they trying to rule out? It sounds like it could be long.
It can be quite extensive, yes. Vets have to be really meticulous. They'll look for dental disease, things like fractured teeth, painful hooks, or abscesses. They'll check the ears thoroughly for mites, infections, or foreign bodies. The eyes are examined for issues like uveitis or corneal ulcers, which can cause light sensitivity and head tossing. They'll investigate the upper airways and sinuses for things like sinusitis or guttural pouch infections. Even other neurological conditions need to be ruled out, or musculoskeletal pain originating from the neck or back. Yeah, and sometimes even ill-fitting tack, like a bridle pinching somewhere, needs to be considered, although that's less common for true photic head shaking. And very rarely, it can be purely behavioral, though that's usually distinguishable. So the workup can involve really detailed oral exams, eye exams, maybe endoscopy of the airways, skull x-rays, and sometimes even more advanced imaging like CT or MRI scans if they suspect something specific.
That's incredibly thorough. It sounds like the owner's input, their observations, must be absolutely critical in this whole puzzle.
Oh, completely vital. A detailed history from the owner is paramount. When did it start? Is it clearly seasonal? What exactly triggers it? Sun, wind, exercise? What makes a better shade? Indoors, nighttime? What do the movements actually look like?
Yeah.
We always encourage owners, if they can, to take videos of the horse's behavior. Videos in different situations out in the bright sun and the shade, while resting, while being ridden. Showing those to the vet provides invaluable clues that you just can't get from a description alone.
That makes perfect sense, seeing it in action. So beyond the history and ruling things out, are there any specific tests or trials that can help confirm photic head shaking more directly?
Yes, thankfully there are a few key diagnostic trials that can be very helpful. One is trying a nose net. These are just fine mesh nets that fit over the horse's muzzle. If putting one on significantly reduces or stops the head shaking, that's quite suggestive. The theory is that the constant, gentle, tactile stimulus from the net helps to kind of override or gate the abnormal nerve signals from the trigeminal nerve.
Interesting, like a constant gentle distraction for the nerve endings.
Exactly that. Another really useful trial involves using UV blocking masks. Specifically, masks designed to block a high percentage of UV light, usually 90% or more. If the horse's symptoms dramatically improve while wearing a good UV mask, especially when out in the sun, that points very strongly towards light being the primary trigger. So, photic head shaking.
Okay, nose nets, UV masks, any others?
Yes, there's a more invasive but often very informative test called the infraorbital nerve block. This involves the vet carefully injecting a local anesthetic around the infraorbital nerve. Remember, that's a key branch of the trigeminal nerve supplying the muzzle. If the head shaking stops or improves significantly while that nerve is temporarily numbed by the anesthetic, it's strong confirmation that the pain is indeed originating from that trigeminal pathway. It's a very important diagnostic step.
Right, that directly tests the nerve involved.
Precisely. And then sometimes just a simple photostimulation test is done systematically observing the horse's behavior in bright sunlight versus deep shade or indoors can help confirm the pattern of light sensitivity.
Okay, so let's say the vet has gone through all this, ruled things out, maybe done some trials, and reach a diagnosis of photic head shaking. What happens next? What are the options for managing it? It sounds like there's no simple cure.
You're absolutely right. There isn't a definitive cure, unfortunately. So the focus really shifts to managing that neuropathic pain and trying to control the signs enough for the horse to have a good quality of life. And it almost always requires a multimodal approach, meaning you usually need to combine several different strategies. One thing alone is rarely enough.
Okay, multimodal. So let's start with maybe the simplest things, environmental changes and physical devices. You mentioned nose nets and UV masks for diagnosis. Are they used for ongoing management too?
Yes, absolutely. They're often the first line of defense. A high-quality UV blocking mask, one that blocks over 90% of UV, can make a huge difference for many horses when they need to be outside. And nose nets, worn during riding or sometimes even during turnout, continue to be effective for a good number of cases, working on that same principle of gentle tactile stimulation.
Makes sense. What else environmentally?
Providing ample access to shade is crucial. That might mean ensuring there are shelters or lots of trees in the pasture or adjusting turnout schedules. So maybe keeping the horse inside during the brightest parts of the day, especially in summer, and turning them out at night or on overcast days instead. And if the horse is ridden, trying to ride indoors in an arena during bright sunny conditions can avoid triggering the symptoms during exercise.
Okay, so environmental adjustments and physical barriers like masks and nets. What about medical options? Are there drugs that can help calm down that hypersensitive nerve?
Yes, there are several medications that vets might try. Often, the first one reached for is cyproheptadine. It's actually an antihistamine, but it also has effects against serotonin, and it's thought to help modulate that nerve excitability somehow. Studies suggest maybe 70%, perhaps even 80% of horses show some level of improvement with it, which is pretty good. But it can have side effects, most commonly sedation or lethargy.
Okay, 70–80% response is encouraging. But what if that doesn't work or isn't enough? Are there stronger options?
Yes. For more severe or cases that don't respond well to cyproheptadine, vets might consider carbamazepine. This is an anticonvulsant medication that's known to be effective for neuropathic pain in humans, and it can help some horses. It's sometimes used in combination with cyproheptadine. However, it needs much more careful monitoring because it can have more significant side effects, things like ataxia or unsteadiness, and potentially liver issues.
Mhm.
It also has quite a narrow therapeutic window, meaning the dose needs to be just right.
So, more potent, but also riskier.
Exactly. There are other anticonvulsants too, like gabapentin or pregabalin, which are sometimes used off-label. There's less robust evidence for them in horses compared to the others, but some vets report success anecdotally.
Right. I've also heard people talk about things like melatonin or magnesium supplements. Do those fit in?
They do, potentially. Some research has suggested melatonin might be helpful, particularly for those horses with strong seasonal patterns. The idea is it might help regulate the horse's response to changing day length, the photoperiod. It might be given year-round to try and blunt that seasonal flare-up. And magnesium supplementation is another option. Magnesium plays a role in nerve function, and the theory is that supplementing it might help stabilize nerve membranes and increase the threshold for firing. One study reported improvement in about 40% of horses on magnesium, so it helps some, but not all. It's generally considered safe and worth trying.
Interesting. Any other medical approaches? Corticosteroids. Topical things.
Corticosteroids like dexamethasone are sometimes used for very short periods during really acute, severe flare-ups to try and break the cycle of inflammation and pain, but they're definitely not for long-term use due to the significant risks, like laminitis. And yes, some people try topical anesthetic creams applied inside the nostrils or on the muzzle, but results tend to be pretty variable and usually only last a short time.
Okay, so a whole toolkit of medical options, but none are guaranteed fixes. What about newer, maybe more cutting-edge therapies? Anything involving nerve stimulation?
Yes, that's an area of ongoing research and development. One technique that has shown some promise is percutaneous electrical nerve stimulation, or PNS. This involves inserting a small needle electrode near the trigeminal nerve under sedation and applying specific electrical currents. The idea is to modulate the nerve's activity, maybe reduce its hyperexcitability. Early results have been quite encouraging in some studies, showing a reduction in symptoms for some horses, although it often needs to be repeated.
PENS. Okay. Now, given how debilitating this can be and the difficulty in managing the pain sometimes, does it ever get to the point where surgery is considered? And I mean, what does that even involve? It sounds drastic.
This is where the conversation gets very serious and, frankly, quite concerning for the horse's welfare. Yes, surgical procedures have been tried as a last resort. Things like infraorbital neurectomy, which means cutting the infraorbital nerve, or maxillary nerve neurolysis, which aims to destroy nerve branches. But, and this is a huge but, these surgical interventions are highly controversial and, honestly, generally not recommended by most equine neurologists and specialists today.
Not recommended. Why are they so controversial? What are the big risks?
The main reasons are that the long-term success rates are often disappointingly low. Maybe only 30% to 50% see significant lasting improvement. And crucially, the risk of serious complications is very high. We're talking about things like developing painful nerve stump tumors, called neuromas, right where the nerve was cut. There's also the risk of the nerve regrowing or other nerves taking over, meaning the sensation and pain just come back. You can get permanent facial numbness, which can cause problems with eating or lip function. And sometimes horses develop even worse abnormal sensations, leading to self-mutilation, constantly rubbing or hitting the numb area. In some cases, the surgery can actually make the head shaking worse than it was before.
That sounds horrific. Making it worse.
It's a very real risk, and these procedures are irreversible. Once you cut that nerve, you can't undo it. So surgery is really only ever considered in the most extreme, intractable cases where the horse is in constant severe pain. All other medical and management options have completely failed, and the only other alternative being discussed is humane euthanasia. It's truly a last resort, and one many vets are very hesitant to pursue.
Understood. A very sobering perspective on surgery. So, putting it all together then, What's the overall prognosis for a horse diagnosed with photic head shaking? Can they live a reasonably comfortable, useful life?
It varies a lot, of course, but generally the prognosis for a complete permanent cure is considered guarded to fair. A true cure is rare. However, the prognosis for management for controlling the symptoms and maintaining a good quality of life is often fair to good in many cases. The primary goal shifts from cure to comfort and function. Can we reduce the symptoms enough so the horse isn't distressed and can still do its job or be a comfortable pasture companion? Often the answer is yes, with the right approach.
So it's really about finding that individualized management plan, knowing it might be a lifelong thing, especially for the seasonal ones.
Exactly. You've really hit on the key point there. The response to any given treatment is highly individual. What works wonders for one horse might do nothing for another. And yes, those horses with seasonal patterns often experience recurrence year after year, so management is an ongoing process. Many horses will need some form of management, whether it's masks, turnout adjustments, medication, or a combination for the rest of their lives. And sadly, we have to acknowledge that in the most severe, unresponsive cases where the horse's welfare is truly compromised despite all efforts, euthanasia does sometimes become the kindest option. It really underscores how crucial that partnership is, a dedicated, observant owner working really closely with an experienced veterinarian to figure out the best possible plan for that individual horse.
Absolutely. Well, we've certainly journeyed from, just a puzzling head flick to understanding this really complex neurological condition, its surprising triggers like sunlight, and the immense dedication it takes to diagnose and manage it. This deep dive into photic head shaking, I think, really shows us the intricate and sometimes quite mysterious ways the nervous system can malfunction, even in our animals. It makes you wonder, doesn't it? What does this condition reveal about this sort of universal experience of neuropathic pain? And how might understanding something like this in horses maybe broaden our perspective on similar, difficult to treat pain conditions in humans? Something to think about.